that should I shut it down and on? Are you?
Hello,
Okay.
everyone. We are just getting connected here. So we'll give everybody just a minute and then we'll go ahead and get started. So make sure to mute your microphones for us, please. Okay, just a couple more joining here. Okay. Hello and welcome, everyone. It looks like we are connected, so please mute your microphones to avoid any accidental disturbances during our presentation. We want to thank you for joining us in South Dakota Project First Line's March Office Hours. Today, we will be discussing healthcare-associated infections. This project is sponsored by the South Dakota Healthcare Association, or South Dakota Healthcare, Associated Infections and Antibiotics Resistance Program. Every month we present a new topic. Office hours are held the second Wednesday of the month at 11 a.m. The South Dakota PFL team is employed by the South Dakota Foundation for Medical Care. We present South Dakota PFL through Project First Line, the national program by the CDC to bring infection prevention healthcare to the frontline healthcare workers and now expanded to all healthcare workers. My name is Rebecca Syme. I serve as the team lead. I am a registered nurse and I'm certified in infection prevention in the long-term care setting. And I will let the other team member who's with us today, Mindy, take a moment to introduce herself.
Good morning, everybody, and welcome. My name is Mindy Hoyer. I am part of the South Dakota Project First Line team. I am a registered nurse and also a certified surgical technologist. Thanks for joining.
All right. And with that, I am going to go ahead and get us started here. A couple of reminders for the presentation today. Please feel free to submit questions or comments in the chat box. We encourage you to share the recording. We are being recorded today, and we will share the recording later on our website, sdprojectfirstline.org. And please complete that survey at the end. It's very important. I know some of us are QR coded out, but that is very helpful to us as a team. So with that, we're going to go ahead and get started. High-level patient safety topics critical to infection control include hand hygiene, proper use of personal protective equipment, and adherence to isolation precautions to prevent the spread of infection. Preventing healthcare-associated infections such as CODI, CLABSI, SSI, VAP, and C. difficile are crucial. Antibiotic stewardship, surveillance, and healthcare workers training also plays essential roles in minimizing infection risks and ensuring safety to healthcare workers and environments in our patients. To cover these topics, we are presenting patient safety today and specifically healthcare-associated infections. Healthcare-associated infections are acquired during the course of receiving medical care in healthcare setting, and were not present upon admission. Key statistics: approximately 1 in 31, today, hospitalized patients has at least one HAI on any given day. Common types of HAIs in the hospital are central line associated bloodstream infections, catheter-associated urinary tract infections, ventilator-associated pneumonia. In the outpatient clinics and long-term care settings, infections related to multi-drug resistant organisms, such as MRSA and C. diff. Surgical centers are surgical site infections. Preventability. Many HAIs can be prevented with rigorous infection control measures, hand hygiene compliance, proper equipment sterilization, and protocol adherence. Emerging concerns: increasing prevalence of multi-drug resistant organisms contributing to complex HAIs. Tracking and reporting: HAIs such as CODIs, SSIs, VAP, and bloodstream infections, MRSA, C. diff, must often be reported to public health authorities. Reporting regulations vary by state and facility type. Most healthcare facilities report HAIs via the CDC's National Healthcare Safety Network. Reporting supports the identification of trends, outbreak tracking, and the development of infection control interventions. Call to action: emphasize ongoing education, adherence to protocols, and vigilance in infection prevention. Foster a culture of accountability and continuous improvement in infection control practices. So you can see there we have kind of a list of all the healthcare associated infections, and what we're going to do is break them down a little more for you in the next slides.
Okay, so carbapenem resistant enterobacterialis, also known as CRE. CRE are infections that are caused by E. coli and Klebsiella bacteria that have developed resistance to the carbapenem antibiotics. These bacteria spread primarily in healthcare settings through direct contact or contaminated surfaces, making them a significant concern in hospitals and long-term care facilities. Some risk factors: your patients with extended ICU stays, they are at high risk due to prolonged exposure in those healthcare environments. The individuals with weakened immune systems or chronic conditions, they are more vulnerable to infection. Medical devices such as catheters, ventilators, they can serve as pathways for bacteria to enter the body. And then extended or inappropriate use of antibiotics can encourage the growth of resistant bacteria. Some symptoms of CRE: they can cause UTIs, pneumonia, also bloodstream infections. Prevention tips for CRE: we want to emphasize the importance of strict hand hygiene amongst healthcare workers, patients, and also visitors. We want to do that rigorous cleaning and sterilization of medical equipment to prevent contamination. Isolation protocols for infected patients to help prevent the spread to others. And then also we want to do that responsible antibiotic use to help minimize the development of resistance. Some facts of CRE: these infections are highly resistant to multiple antibiotics, limiting effective treatment options. They commonly affect vulnerable patients in healthcare facilities, particularly those with compromised immune systems. In some complications of CRE, these infections can lead to severe outcomes, including sepsis and even organ failure. They often result in prolonged hospital stays and increased treatment costs. And high mortality rates are associated with CRE infections, especially in patients with underlying health conditions. Next slide.
Carbapenem-resistant Acinetobacter primarily spreads in healthcare settings through contact with contaminated surfaces and equipment. This pathogen is especially concerning in hospitals and long-term care facilities due to its high resistance to antibiotics. Risk factors: prolonged hospital stays, especially in the ICU. Increased exposure risk: individuals with weakened immune systems or chronic illnesses are more susceptible. Medical devices such as ventilators and catheters can facilitate the spread of infection. Extended or inappropriate use of antibiotics promote resistance, making infections harder to treat. Pneumonia, characterized by symptoms like cough, fever, and difficulty breathing. Bloodstream infections, symptoms include fever, chills, and signs of sepsis, which can be life-threatening. Wound and surgical site infections, look for redness, pain, swelling, and pus around the site. Prevention includes emphasize the importance of hand hygiene for both healthcare workers, patients, and visitors. Regular cleaning and sterilization of medical equipment to prevent contamination. Isolate infected patients when necessary to prevent the spread to others. Antibiotic stewardship. Limit unnecessary antibiotic use to slow resistance development. Acinetobacter is highly resistant to multiple antibiotics, which limits treatment options, known for causing hospital outbreaks due to its ability to survive on surfaces for extended periods. Complications: infections can lead to sepsis and multi-organ failure, particularly in vulnerable patients. Infections often result in longer hospital stays and increased costs. High mortality rates are associated with these infections, particularly in patients with compromised immune systems.
Candida auris. C. auris is a fungal infection that spreads easily in healthcare settings, often via contaminated surfaces or direct contact. It is particularly dangerous because of its resistance to antifungal treatments. Some risk factors would be your patients in the ICUs or long-term care facilities, individuals with weakened immune systems or chronic illnesses, use of medical devices like catheters and ventilators, and broad spectrum antibiotics or antifungals can disrupt that normal flora, allowing C. auris to thrive. Some symptoms of C. auris: we have our bloodstream infections that could be fever, chills, signs of sepsis, which can be life-threatening. Those wound infections, redness, swelling, and pain at the infection site. Another common symptom is ear infections. They will have discomfort and discharge in some common cases involving the ear. Some prevention tips. Once again, we want to emphasize the importance of hand hygiene for healthcare workers, patients, and visitors. That rigorous cleaning and disinfection of surfaces and medical equipment to prevent contamination. Isolation protocols for infected or colonized patients to limit the spread. And then careful use of antifungal treatments to prevent resistance. Some facts on C. auris. It is highly resistant to many antifungal medications, making it very difficult to treat. It can survive on surfaces for long periods of time, contributing to its role in healthcare outbreaks. Outbreaks commonly occur in hospitals, affecting the most vulnerable patients. Some complications, we have that severe bloodstream infection that could lead to sepsis and organ failure. Infections often result in longer hospital stays and increased healthcare costs. And then mortality rates are high, especially in patients with compromised immune systems. Next slide.
Methicillin-resistant Staphylococcus aureus is a strain of Staphylococcus aureus bacteria that has become resistant to methicillin and other antibiotics. It spreads through direct contact with infected wounds, contaminated hands, or surfaces, making it a concern in both healthcare and community settings. Risk factors. Hospitalization and long-term care stays increase risk, especially for patients with open wounds or invasive devices like catheters. Individuals with weakened immune systems or chronic illness are more susceptible. Crowded environments, such as sports facilities, schools, or prisons, contribute to the spread of community-associated MRSA or CA-MRSA. Symptoms: skin infections. They may be red, swollen, and painful lesions or boils that may drain pus. Wound infections. Symptoms include redness, swelling, and drainage. Bloodstream infections. Severe cases can cause fever, chills, and sepsis. Pneumonia in rare cases. MRSA can cause respiratory infections, leading to cough, fever, and difficulty breathing. Prevention. Stress proper hand hygiene for both healthcare providers, patients, and community members. Ensure wounds are properly cleaned and covered, that's important, to reduce exposure risk. Disinfection of high-touch surfaces and medical equipment is essential in preventing the spread. So those things that we use from patient to patient every day, make sure we're cleaning and disinfecting those properly in between. We want to also implement isolation precautions for infected patients in healthcare settings to limit transmission. Facts from MRSA. MRSA is categorized as healthcare-associated or HA-MRSA or community-associated CA-MRSA, with the latter increasingly found in non-hospital settings. It's resistant to multiple antibiotics, makes it particularly challenging to treat. Some complications: severe infections can lead to life-threatening conditions such as sepsis, organ failure, or death. MRSA can spread to bones, joints, or internal organs, further complicating treatment. Prolonged hospital stays and higher healthcare costs are common outcomes of MRSA infections. Mindy?
Vancomycin-resistant enterococcus, also known as VRE. VRE is caused by Enterococcus bacteria that have developed resistance to vancomycin, one of the last resort antibiotics. It is typically spread in healthcare settings through contaminated hands, surfaces, or medical equipment. Some risk factors would be your patients in ICUs or long-term care facilities, those with weakened immune systems or chronic conditions, the use of medical devices such as catheters or IV lines, and then prolonged or inappropriate use of vancomycin or other antibiotics can lead to resistance. Some symptoms of VRE can be UTIs, painful urination, increased frequency, and fever are common signs. Bloodstream infections would be fever, fevers and chills and sepsis symptoms that can occur in severe cases. Wound surgical site infections, look for redness, swelling, and drainage at the infection site. Some prevention tips. Once again, we want to emphasize that strict hand hygiene practices for healthcare workers and visitors. Ensure the rigorous cleaning and disinfection of services and medical equipment. Use antibiotics responsibly to minimize resistance. And then implement isolation protocols for infected or colonized patients to limit the spread. Some facts of VRE. It is resistant to vancomycin, making treatment options limited and more complex. It is commonly found in healthcare environments and can colonize patients without causing symptoms. So you're asymptomatic carriers. Some complications of VRE. Severe infections can lead to sepsis and organ failure, particularly in high-risk patients. VRE infections often result in prolonged hospital stays and increased healthcare cost. And the mortality rates are higher in patients with VRE infections, especially when treatment options are limited. Next slide.
Extended spectrum beta-lactamase producing Enterobacterales, such as E. coli and Klebsiella, produce enzymes, ESBLs, that break down common antibiotics like penicillins and cephalosporins, making them resistant to treatment. Risk factors: patients in ICUs or long-term care facilities are at high risk due to prolonged exposure and the use of medical devices. Weakened immune systems or chronic illness increase susceptibility. Frequent or prolonged use of antibiotics disrupts normal flora, allowing resistant bacteria to thrive. Symptoms: UTIs, painful urination, fever, and urgency are common indicators. Pneumonia, cough, fever, and difficulty breathing can occur. Bloodstream infections, fever trills, and sepsis symptoms indicate severe cases. Prevention: stress the importance of hand hygiene and proper disinfection on surfaces and equipment. Responsible use of antibiotics can help reduce the emergence of resistance bacteria. Isolation protocols for infected or colonized patients limit the spread of these organisms. Rapid detection and reporting of ESBLs producing bacteria help control outbreaks. Facts: these bacteria are highly resistant to antibiotics, particularly penicillins and third-generation cephalosporins. ESBL-producing bacteria can spread in both healthcare and community settings, making them a widespread concern. Complications include severe infections may lead to sepsis and organ failure. Patients with ESBL infections often require longer hospital stays and more expensive treatments. Limited treatment options due to antibiotic resistance increase mortality risks in vulnerable populations.
Multi-drug resistant Pseudomonas aeruginosa is a bacterial infection that has developed resistance to multiple antibiotics, including carbapenems. It is spread in healthcare settings through contact with contaminated surfaces, medical equipment, or person to person. Some risk factors would be your prolonged hospital stays, especially in ICUs, patients with weakened immune systems or chronic conditions, use of medical devices such as ventilators and catheters, and overuse of improper use of antibiotics contributes to the resistance. Some symptoms of this, pneumonia, common signs include cough, fever, and difficulty breathing. Bloodstream infections, symptoms like fever, chills, and sepsis may develop in severe cases. Wound surgical site infections, look for redness, swelling, and drainage at the infection site. And then also UTIs, that painful urination, fever, and urgency and frequent indicators. Some prevention tips: emphasize the importance of hand hygiene for healthcare workers and visitors. proper cleaning and sterilization of medical equipment, isolation of infected or colonized patients, and then responsible antibiotic use slows the development of the resistance. Some facts: the bacteria thrive in moist environments such as sinks, medical equipment, and humidifiers. It is a common cause of hospital-acquired infections, particularly in critically ill patients. Its high resistance to multiple antibiotics limits treatment options, complicating care. Some complications: severe infections can lead to sepsis and organ failure. Infections result in prolonged hospital stays and increased healthcare cost. And then high mortality rates are associated with multi-drug resistant strains, especially in your vulnerable populations. Next slide.
Ventilator-associated pneumonia. It happens when bacteria get into the patient's lungs and cause an infection. Bacteria or fungi invade the lungs of a patient on mechanical ventilation. Spread through contaminated equipment, aspiration, oral gastric contents, or prolonged intubation. Some risk factors: prolonged use of mechanical ventilation increases the risk of infection. Poor oral hygiene and aspiration of secretions can lead to bacterial growth in the lungs. Patients with weakened immune systems or pre-existing lung conditions are more susceptible. ICU and long-term care settings contribute to exposure risk. Patients who smoke get more infections. For more information about how to quit before surgery, you can go to the South Dakota Quit Line at sdquitline.com. Symptoms. Symptoms include fever, chills, and fatigue, indicating an infection. Patients often exhibit increased respiratory secretions and difficulty breathing, low oxygen levels, and abnormal chest x-rays showing lung infiltrates confirm the diagnosis. Prevention. Emphasize hand hygiene to reduce the risk of cross-contamination. Elevate the head of the bed, minimizes aspiration of secretions. Routine oral care with antiseptic solutions reduce bacterial colonization. Daily assessments of sedation and readiness for extubation, can reduce ventilator dependence. Facts. VAP is common and serious ICU-acquired infection associated with increased morbidity and mortality. It often involves multi-drug resistant organisms, complicating treatment. The infection significantly increases hospital stays and healthcare costs. Complications. Severe infections can lead to sepsis and multi-organ failure. Acute respiratory distress syndrome, ARDS, may develop, further complicating treatment. Prolonged mechanical ventilation and hospitalization are common outcomes. High mortality rates are observed, particularly in critically ill patients.
Catheter-associated urinary tract infections, also known as CAUTIs. Those occur when bacteria or fungi enter the urinary tract through a catheter, often due to improper insertion, contamination, or prolonged use. Some risk factors: prolonged catheter use significantly increases infection risk. Improper catheter care or poor insertion techniques. Weakened immune systems and chronic conditions. And hospitalized or long-term care patients are at a higher risk due to frequent catheter use. Some symptoms of CAUTIs. Common signs include painful urination, fever and chills, cloudy or foul smelling urine, and lower abdominal discomfort are also indicators. Severe cases may lead to systemic symptoms like fatigue or signs of sepsis. So prevention tips: we want to limit catheter use, only use when necessary and remove as soon as possible. Hand hygiene: ensure strict adherence to hygiene during insertion and care. Sterile techniques: use sterile equipment and maintain a closed drainage system. And then monitoring: regularly check for early signs of infection to intervene promptly. Some facts on CAUTIs: it is one of the most common healthcare-associated infections, yet highly preventable with proper protocols. These infections increase hospital stays and healthcare costs significantly. Some complications of CAUTIs: untreated CAUTIs can lead to serious complications like kidney infections or sepsis. Repeated infections can cause long-term urinary tract damage, and there is a heightened risk of antibiotic-resistant infections due to repeated antibiotic use. Next slide.
Central line-associated bloodstream infections occur when bacteria or fungi enter the bloodstream through a central line, often due to improper insertion, maintenance, or contamination. Common pathogens include Staphylococcus aureus and Candida species. Some risk factors. Prolonged use of central lines increases the risk of infection. Improper insertion or care techniques can introduce bacteria or fungi into the bloodstream. Weakened immune systems, chronic illnesses, and ICU stays place patients at higher risk. Some symptoms. Early signs include fever, chills, and fatigue, indicating an infection. Redness, swelling, or discharge at the catheter site may signal a localized infection. Advanced cases can cause systemic symptoms such as low blood pressure and rapid heartbeat, indicating sepsis. Prevention tips emphasize the importance of sterile techniques during insertion and maintenance of central lines, maintaining strict hand hygiene, and use personal protective equipment to reduce contamination risk. Regularly assess the need for central line and remove it as soon as it is no longer needed. Proper site care, including antiseptic dressings, reduces infection risks. Some facts. CLABSI is a common but preventable healthcare-associated infection. It significantly increases hospital stays, treatment complexity, and costs. Complications. If untreated, CLABSI can lead to sepsis, multi-organ failure, and death. Patients often require prolonged hospitalizations and more intensive care treatments. It contributes to higher mortality rates, particularly in critically ill or immunocompromised patients.
Surgical site infections, also known as SSIs, those occur when pathogens such as bacteria or fungi enter the surgical site during or after surgery. Common causes include contamination of equipment, environment, or improper wound care. Some risk factors. Contaminated surgical environments or poor hygiene practices increase the risk of infection. Prolonged surgery and hospital stays elevate the chances of exposure. And patient-specific factors such as weakened immunity, diabetes, and obesity significantly increase susceptibility. Some symptoms of SSIs. They often present with redness, swelling, warmth, and pain around the surgical site. Pus, discharge, or delayed wound healing are signs of a infection. Severe cases may include systemic symptoms like fever, chills, or fatigue. Prevention, use sterile surgical techniques and maintain a clean environment during procedures. Administer prophylactic antibiotics as recommended to reduce infection risk. Emphasize hand hygiene for surgical staff and patients, and ensure proper wound care and monitoring for early signs of infection. Some facts about SSIs. They are among the most common healthcare-associated infections. They can range from superficial infections to those involving deeper tissues or organs. SSIs increase hospital stays, delay recovery, and significantly raise healthcare costs. Some complications. Untreated SSIs can lead to sepsis or abscess formation. Infections may result in delayed recovery, rehospitalization, or long-term wound healing issues. Severe infections have higher mortality rates and may cause permanent scarring.
Clostridioides difficile infection is caused by the growth of C. difficile in the colon, typically after antibiotics disrupt the normal gut microbiome. The infection spreads via fecal-oral transmission, often through contaminated hands or surfaces. Risk factors. Recent antibiotic use, especially broad-spectrum antibiotics, is a leading risk factor. Hospitalizations or long-term care stays increase exposure to contaminated environments. Weakened immune systems, advanced age, and the use of proton pump inhibitors further raise susceptibility. Symptoms. Common symptoms include frequent watery diarrhea, abdominal pain, and cramping. Fever, nausea, and loss of appetite are also indicators. Severe cases may involve dehydration, bloody stool, or signs of system illness. We can promote judicious use of antibiotics to avoid disrupting the gut microbiome, emphasize hand hygiene. Unless hands are visibly soiled, alcohol-based hand sanitizer is preferred over soap and water for cleaning hands in most clinical situations. The recommendation for soap and water is in the event of an outbreak of suspected or known C. difficile or norovirus. Ensure thorough cleaning and disinfection of healthcare environments to eliminate spores. Isolate infected patients to prevent transmission. CDI is one of the most common healthcare-associated infections, but can also occur in the community. The spores are highly resistant to environmental cleaning, requiring specialized protocols. Severe cases can lead to dehydration, kidney injury, toxic megacolon, or bowel perforation. CDI can progress to sepsis and multi-organ failure if untreated. Reoccurrence rates are high, making prevention and early treatment critical.
Klebsiella. Klebsiella bacteria are often spread through direct contact, mainly in healthcare settings. This makes it a significant concern for hospitalized or immunocompromised patients. Some risk factors would be hospitalization, especially your patients that stay in the ICU. That increases their risk due to exposure. Those with weakened immune systems or chronic conditions. Medical devices such as ventilators or catheters. And prolonged use of antibiotics can also increase the risk by disrupting that normal bacteria balance. Some symptoms, pneumonia, characterized by cough, fever, and chest pain. UTIs, patients may experience pain during urination and increased frequency and lower abdominal discomfort. Bloodstream infections, severe cases can lead to sepsis, causing fever, chills, and an altered mental state. Some prevention tips emphasize the importance of hand hygiene and regular hand washing to prevent spread. Healthcare settings must ensure proper sterilization of equipment to avoid contamination. And then antibiotic stewardship is critical in reducing unnecessary antibiotic use, which can prevent resistant strains from developing. Isolation protocols should be followed for infected patients to prevent cross-contamination. Some facts on Klebsiella. These infections are commonly resistant to multiple antibiotics, particularly carbapenems, making treatment difficult. Most infections occur in hospitals and long-term care facilities, underlining the importance of infection control. Some complications. Severe infections can lead to sepsis and organ failure, which are life-threatening. And due to antibiotic resistance, these infections often result in prolonged hospital stays and increased mortality rates.
Hang in there, guys. We are almost to the end. Non-tuberculous mycobacteria infections are caused by environmental bacteria found in soil, water, and dust. These bacteria enter the body through inhalation, ingestion, or skin breaks. People with weakened immune systems, such as those with HIV, cancer, or transplant patients, are at higher risk. Pre-existing lung conditions like COPD, bronchiectasis, and cystic fibrosis significantly increase susceptibility. Advanced age and frequent exposure to contaminated water sources, such as hot tubs and showers, are additional risk factors. Pulmonary infections symptoms include chronic cough, fatigue, fever, weight loss, and shortness of breath. Skin infections. These can manifest as redness, swelling, or painful nodules. Disseminated infections or immunocompromised individuals. Symptoms may include fever, night sweats, and organ involvement. Avoid exposure to contaminated water and soil, particularly for individuals in predisposing conditions. Practice regular disinfection of water systems, especially in healthcare settings. Monitor individuals with pre-existing lung conditions for early signs of infections. NTM is not contagious and cannot spread from person to person. There are over 190 species of NTM with varying levels of risk for causing infection. Pulmonary NTM infections mimic tuberculosis symptoms and are the most common form. Chronic lung infections can lead to severe lung damage and reduce quality of life. In immunocompromised individuals, the infection can spread, causing disseminated disease. Treatment is prolonged, requiring multiple antibiotic use. Significant potential side effects exist.
Here is the list of resources for strategies for preventing HAIs. As you can see, we have stuff on hand hygiene, antibiotic stewardship, surveillance and monitoring. If you would like these resources, please put your name and your email in the chat and we'll be more than happy to share those with you. We will also put this on the South Dakota Project First Line website so you could access it there as well.
All right, that was a lot of stuff today. I feel like we've been covering a lot of good stuff, but with that, I'd like to take an opportunity to see if there are any questions.
Hey, this is Jess. I'm just going to jump in quick and share. We do have the CAUTI compendium presentation coming up on April 2nd at noon. That will be by Dr. Elizabeth Wobowski-Scruggs. She is the co-author of the compendium. I put the registration link in chat also if you're interested in joining that.
Thank you, Jess. And I do see that we have got some persons who have attached their email in the chat. So we'll make sure to get you a copy of this and for sure those resource links. Thank you all for being here today. I'll give one last blip for anyone to ask questions. Otherwise, with that, your feedback is so very, very important. And I know we're kind of QR coded out, but if everyone would please take a moment to scan the QR code, it's a real simple form there. If you would complete that for us, we sure would appreciate it. I will leave that there for a little bit. And thank you all for the great comments. We're doing our best to bring you stuff that's useful to you every month. A little bit of more time there. If you would please scan that QR code. All right, with that, we are going to move on. In closing, here are some great resources that we have available, as well as the CDC from Project First Line. You can scan that QR code, yes, another QR code, but that will take you to our website, or you can go there directly at sdprojectfirstline.org. You can connect with us there. You can watch a recording of this. You can watch past recordings, lots of good stuff there. So thank you all for your time. At this time, unless you have any questions or any needs from us, you are free to disconnect.